I'm Dr. Selma Kelmes from Los Angeles. I'm going to talk on Pentothal in the tropics during World War II. Anesthesia problems in the Pacific theater were much worse compared to Europe and Africa. No anesthesia consultant was appointed until nearly the end of the war. This was a low priority area. And so there was no anesthesia leadership or liaison with the military. Also, the vast distances in the Pacific, the frequent loss of ships carrying supplies, and climate issues, heat and humidity, meant many more problems for those giving anesthesia in the Pacific. Letters and articles by World War II anesthesiologists in that area make clear that medical gases, airway items, and supplies for anesthesia machines were not available, and they had to make do. This item, an article on the use of Pentothal in the tropics, was based on another article by a British anesthetist practicing in a tropical area during World War II, and giving the many reasons why Pentothal was useful, and also documenting his inventions of a clamp to hold the syringe and the IV bottle, and a mouth prop to help deal with possible airway obstruction. Pentothal was released in the United States in 1934, and few anesthesiologists had used it by the time the war started. So there was little experience. In spite of the possible problems, such as circulatory collapse in patients who had lost blood volume, airway problems in those with facial injuries, and technical difficulties administering it, Pentothal soon became widely used, both alone and in combination with local, regional, or nitrous oxide, if that was available. You could work without an anesthesia machine or medical gases. Most patients maintained respiration, and patients woke up quickly, usually. Storage wasn't an issue because the drug was packaged as a dry powder and was reconstituted on site. Problems identified were reported in the ANLET letters, which were circulating problems and successes of anesthesiologists throughout the war fronts. An anesthesiologist wrote from New Guinea in 1943, Pentothal certainly has earned its place in the sun as far as we are concerned. After the war, Pentothal came into common use and remained the induction drug of choice until propofol appeared in 1986.